Sophie, thank you once again for a really clear presentation of what is often quite a tricky concept to get over. Um, I'd like to kick off the questions if I may. Could you make a comment on the association between Dupuytren's disease and BMI? This is something that really fascinates me, as you probably know.
Yes.
Um, what do you think about this association with BMI?
Yes. So to summarize the things we know about Dupuytren's disease and BMI is that in observational studies we see that with increasing BMI, the risk of Dupuytren decreases. So it looks like it's protective, and there's actually been a genome-wide association or correlation, I'm sorry, between BMI and Dupuytren's. Yeah, so I find this very interesting, but I'm very curious what the mechanism behind it is. I'm actually not too sure what to think about it.
Yeah, so it is really interesting, and we've shown it in some big studies. We've also shown a negative correlation in a Mendelian randomization study. So essentially, what that means is that the genes that put up your BMI work against you getting Dupuytren's. There's only one other disease which I can find in the medical literature where having a raised BMI protects you against it, and that's anxiety. So yeah, it is very interesting. And what you may not be aware of is that another surgeon from the Netherlands did a study actually with a surgeon from Florida as well, Charlie, Roger Corey,
Yep.
where they use multiple needle fasciotomies really, but mini fasciotomies, and then put fat grafting in. And I think Paul may have been involved in that study as well. And they showed results quite similar to having a limited fasciectomy. So I think the fat is doing something locally, and I think biologically that's quite interesting. And certainly as a surgeon, I try to leave the fat that I find in the finger behind when I'm doing a fasciectomy, in case that is somehow suppressing recurrence. I don't have any data for that, but I think it is very interesting. Okay, questions from the floor. Jagdeep Nanchahal from Oxford would like to ask about TGF beta may play a key role in Dupuytren's according to your data, but all the clinical trials that have targeted TGF beta for other fibrotic conditions have completely failed. And some have had to terminate early because of increased morbidity and mortality. Can you explain this discrepancy?
Yes, I think what the interesting thing is in Dupuytren's is it involves several signaling pathways, and TGF-beta does play an interesting role, but it probably also is not the key driver. It's probably resultant of regulatory genes, I think. So I think targeting, well, let's call it a downstream gene, is probably not the answer to its treatment. But I could, of course, be wrong. That's just my opinion.
Okay, I've asked this question of Jagdeep as well, that there are lots of signaling pathways that you've highlighted, and how successful do you think ever targeting one signaling pathway will be?
I don't think it will be too successful to target only one. I think the key is to target several at a time. I think it's important to find genes that may regulate several signaling pathways at a time. And perhaps if we can find a combination of, for example, two medications that target several signaling pathways at once, maybe we'll be successful in future, but we're not there yet, I think.
Okay, a couple more questions about fat and BMI. Well, one comment from Jane Mitchell. Raised BMI is also protective for osteoporosis to some degree. I didn't know that, so thank you very much for that piece of information. I'd be interested to read that study for sure. And Adrian Trojanowski from Norwich, sort of asking a question of David O'Gorman, who